And we're on. There we go. So, good morning and welcome to the MSI Prevention and Road Safety webinar. My name is Satvinder Bastran. I am with the Community Social Services Health and Safety Association of BC, and I'll be facilitating this session this morning. I'd like to acknowledge that I'm speaking to you from the territory of the Coast Salish peoples, including the territories of the Musqueam, Squamish, Tsleil-Waututh nations. We'd like to acknowledge the lands and the territories of the First Nations that you are all calling in from today for this webinar, and also the presenters respecting the First Nations territories and lands that they're speaking from this morning as well. And so I know a number of people will be jumping on as we're kind of navigating through this. I want to be very kind of economizing of your time. We're very thankful that you are joining us this morning. The intention of the MSI Prevention and the Road Safety webinar is to provide members an introductory high-level overview of injury statistics, best practices, and provide important information along with resources to the community social services sector. This webinar will be presented into two parts, and participants will have the opportunity to engage in asking questions in the chat. Both Ann and I will keep an eye on that and bring these questions to the attention of the speakers. Before we begin, just a few items, housekeeping components. This webinar will be recorded and serve as a record and reference for the future, presentations as well from learning, and also for organizations and workers to access at their leisure. I've learned that a number of organizations are using a lot of our webinars as training for staff in their orientations and for their health and safety committees as well. And so thank you for that. Because this is a short presentation, there will be no break. It's over a 2-hour period. Both speakers will have about an hour to speak, and we'll be able to, as I mentioned earlier, answer your questions either through their presentations or at the end of the session as well. There will be a survey at the end of the session. Please make sure you complete that survey. Your feedback is valuable to us. It provides us guidance and support and sort of navigating to the future for future topics and issues as well. This presentation will be also be provided to you on our website. And so once this information, once we've completed, we'll make sure that we get it on there and bring it to your attention. Folks that are participating in the session this morning will receive a certificate of attendance from the association as well. Now, in the event, if we lose our precious speakers in the event due to technical difficulties, we will do our very best to beam them back within our capacity. If we're not able to, we'll definitely find ways to kind of bridge that. But regardless, you will have the ability to have access to the presentation. And also, I would be more than happy to provide their contact information so that you're able to contact them directly as well. Now, matter at hand, I'm delighted to introduce two very experienced speakers. I've had a great opportunity to get to know them better over the last couple of weeks. The first presentation will be on the MSI piece, and the second part will be on the road safety. I'm delighted to introduce Dr. Wright. For many years, he has experience in ergonomics and occupational health and safety, and was the principal consultant with Ergonomics Plus Incorporated in Toronto. Before moving to Vancouver in 2001, he was a technical advisor and provided guidance on ergonomics to the city of Vancouver prior to this role. And so thank you, Jeff, for being here. Really appreciate it. I'm also going to introduce Rick Walters, who is a subject matter expert from the Road Safety at Work program. Rick has a key role in creating and developing web-based tools and resources aimed to helping BC employers and workers understanding and living up to their road safety responsibilities. So with that, I'm going to hand it over to Jeff, and then we'll be followed by Rick's presentation. So Jeff, thank you. And thank you, Rick.
Thank you for the introduction, and I will get set up here. And should be good. Let me know. Are you able to see my screen? Is that a yes?
Not yet, John.
Not yet. Okay, that's problematic. Let me try that. That should work. Let's just see for a second here. No, that doesn't look right for me. Is that working?
Yeah, it looks great.
Is it the full screen?
Looks good to me.
Yeah, all right. Well, that's not what I'm seeing on my screen, but anyway, that's fine. Yeah, I'm pleased to be talking. The purpose of this talk is to obviously talk about MSI prevention, and I'll outline some general concepts and around the world of work and highlight the underlying concepts of ergonomics and WorkSafe BC's MSI regulation. There's obviously, when it gets posted, there's going to be a disclaimer. Basically, that says that shouldn't be modifying any of the presentation. So are you now seeing the list of topics that are going to be presented?
Yep, we can see it. Thank you.
Okay, good. All right, I've just fixed the problem I've had. So I am good. So the world of work is and what I'm going to be covering is the world of work and then a little bit about ergonomics. So in the world of work, I'm going to be identifying the components that constitute the world of work. And then I'll be through the ergonomics, outlining the ergonomics approach and how it interfaces with the world of work. I want to mention the legislative requirements for consultation, and you'll notice consultation is a big theme that I have throughout this. I then want to have a little bit of fun by talking about MSI control, but the MSI control concept that to me, I think is sort of the takeaway. I call it Jenga in reverse, and I'll explain why that goes as a reasonable way of thinking about how to control MSIs. And then I want to finish by showing resource materials that are available for musculoskeletal injury prevention. So the world of work, all of us are very familiar with our own world of work, and we have our own descriptors for it. Fortunately, in a sense, there are groups such as the International Ergonomics Association that formally characterize the term, and that's where I actually obtained it from, or the IEA talks about the world of work. Later in this presentation, I'll show you the model and explain the approach ergonomists use when analyzing the MSI risks in the world of work. This description that is most appropriate for this talk and the approach that I prefer to use comes, as I mentioned, from the International Ergonomics Association. Before I go into describing the world of work, we want to look at some statistics to describe what we know about MSIs in the world of work. These are statistics are available. I took them off the web page on your association sat. So, but I wanted to highlight them to bring an important message home. And when we look at some of the stats to describe what we know in the world of work, you'll see that injury rate comparison by sector. And you'll notice that injury rate is higher in long-term care. So that's, we could say, is sort of a good news. If you look at down on the bottom of the text here, you can see that there are the other groups that are listed there, and you can identify if you're with a particular one where you would fall, but you can see it's going to be different than in the healthcare sector in the long-term care. This next slide shows serious injury claims versus time loss claims. And the significant piece to notice there is that time loss claims are a significant workplace injury in BC. That's not to make light in any sense of the serious injury claims. They are hugely costly. They are just so disruptive. But what a lot of people don't realize is that if you look at it as an aggregate, the time loss claims themselves are also very disruptive to everyone, to people, to organizations, and they're ideally, given the high number, we should be able to do more to control them. So when we look at them, we want to look at the largest single source of lost time claims, You can see here that most frequent and common cause of MSIs related to MSIs is overexertion, and MSI claims represent about 32% of all claims. And I wanted to make note of the other two significant factors in there. One is 12% of claims. Now this is right across the board. And then acts of violence and force which is a significant factor, definitely in the sectors that you're working in. That's 4% of claims across the board. So if we look at it by incident type, and just in relation to this, your particular sector, you can see that the overexertion actually increases from that overall rate. So it's 42% of the claims in your sector. And it falls on the same level, or 12%. That was the same as in the previous slide. But you'll notice that acts of violence and force are 13% of claims. And that's higher than was on the previous slide. So based on the statistical information from the slides, we see that the three most commonly reported incident types are obviously overexertion. And by overexertion, basically forces or loads or repetitive motions are hugely significant. The forces, obviously, the load that you're lifting can exceed your personal care abilities. So it's above your tissue tolerances. And you can see for repetitive motion that repeated motion repeatedly loads and weakens tissues. So, and then when we combine overexertion with falls on the same level and acts of violence, that represents 2/3 of all lost time claims. And that's really very significant. So what we now want to look at is, obviously, MSI prevention is vital to any organization, given that percentage of claims. I want to just briefly cover some of the common risk factors contributing to overexertion claims. And you can see on the slide here, if these factors are present, then the overall risk is increasing. So obviously one of the goals would be to try and avoid situations with awkward postures, and typically areas that would probably occur in the type of work that you do is inappropriate work heights or excessive reaches. Repetition and duration, that's a function of how the work is actually organized. That's a little and often outside of your control. And force and the load characteristics. And you can see and think when we're going to be talking near the end just about the whole difficulty in a general sense about moving, if you have to move people from one place to another, and that requires some assistance, then force is going to be a significant factor. Now, these are only three of many factors that are contributing to the MSI loading, and so I've put some of the other factors on this slide, and they're related to overexertion claims. They're also involved in other claims as well. But static loading, in other words, holding a prolonged posture for a prolonged period of time. Local contact stress, that's just direct pressure on your hands, arms, or legs. So if you were kneeling, for example, for long periods of time, that would put pressure on your knees. And this is where we start seeing some of the aspects of ergonomics and the total work system approach that ergonomics takes, because other factors that are listed are environmental factors, psychosocial factors. An administrative consideration is how much training someone has had, or are you accustomed to the activities you're performing? And then individual characteristics. And in some cases, there are pre-existing situations that need to be taken into account. So as you look and think about what was information covered on the last two slides, some of these factors can be controlled in your world of work, and some are much more difficult to control. So those are things that I want to explore, and hopefully we get some questions later about that. So there are many reasons why preventing MSIs is important, and it's putting here, as you can see, a list of factors in a general sense. So that's why you might want to be motivated and intent on controlling MSIs. MSIs represent the most frequent and most common lost time injuries in the workplace in BC. We covered that with those stat slides. The other important factor to realize is that MSIs can become long-standing. So there's a long recovery, and they have irreversible in some cases or disabling health effects that interfere with a healthy lifestyle, and no one wants that. The important part about MSIs, and that's the reason for giving talks like this, is the earlier MSIs are identified and reported, the better the chance of a full recovery. Mentioned earlier in my resume coverage that I spent a lot of time with the city of Vancouver, and there it was very clear. We were able to have the individuals let us know early on that they were having issues and concerns. We were able to, and I would do on-site visits for them. We were able to go and fix the problem, and then they would recover. And the sooner they told us there was a problem, the easier it was in a general sense to stop any further development of that MSI potential. And it wasn't an injury at that point, it was discomfort, but that's the key flag. And we'll talk about that in a slide later. But the earlier the MSIs are identified and reported, the better the chance of a full recovery. So that's where the preventive mode comes in. One of the other very important themes that in this talk is involve the workers. The workers are the ones that know a lot about the work that's being done. They're the experts in the work that's being done, and they often have excellent and innovative ideas that they can talk about and cover and provide good advice and direction on ways to effectively solve a particular situation that might involve MSIs. That doesn't mean that you don't need to have some expert comments and advice involved in their suggestions, but it does mean that the suggestions they're presenting are definitely worth taking a look at to see if it's feasible and reasonable to implement them. And the last point, of course, and the ultimate goal of being an ergonomist and being in prevention is that we want to improve the health and well-being of the workers, and also for the employer, they actually can run their operation in a safer and more efficient manner. So let's look now at how ergonomics fits into the world of work. And ergonomics, and there are many definitions of it in an occupational setting. I talk about ergonomics being the science of people at work. But the key aspect of ergonomics is that we are concerned about understanding the interactions among workers and the other components in the work system. And this is just a little diagram you can see here, just showing how important the human is, and these are the other components in the work system. We'll be defining those in a minute, but you can define them and categorize them in many different ways, and you can pick on your favorite way to describe what you consider to be the world of work. In an ergonomics perspective, we're looking at how humans interact with the work tasks, the workplace, the tools and equipment, the environment, and the organization's management and planning. And that's represented here in another model of the world of work. I like to use the term total work system. I put the word total in front of there because it's I think I just advanced and didn't want to. It's important in the sense of looking at how they all interact together, and it's the where the human interacts with each of those components in the work system that is really the skill that an ergonomist can bring. And if you look at the components that are often used in the world of work, you can see it deals with the tasks and the work processes, the equipment and facilities, the environment and the management system. And they're all very key, and you do have to be aware and have knowledge about what risk factors are being produced by those components. But the most important component in the work center, in the work, is shown right in the center. It's the worker. The worker is, from an ergonomics perspective, the perspective that we take to look at those interactions. We want to know how the worker is interacting with each of those components. And as I said, we want to consider the human interactions. But another really important characteristic that you always have to keep in mind, if you make any changes in any one of the other components in the work system, it could have and will have likely an effect not only on the worker, but on some of the other aspects of the other parts that are being involved. So it could be you could make a management change, but that could have changed obviously how you the task and the work is done. Some of the other changes, if things change in the environment, it works back again. It's going to make a difference in the task and work processes. It could influence equipment and facilities. It could influence the management system. So that's the sort of interrelated concepts that become really important from an ergonomics perspective. Change in one part of the work system can affect one or all of the components in the total work system. So an employer needs to ensure that the requirements placed on the worker do not exceed what a worker can do safely. As we say, the workers are at the center of the work system. And as I talked about briefly, the workers are a key source of information about the demands of the job, the potential MSI hazards, and have suggestions on fixing it. So for everyone, I would say there are some important questions you should be asking yourself. Are workers actively involved in the process? And is there an appropriate and effective system for employees and their supervisors to raise health and safety concerns? And fortunately, we do have the MSI regulation, and that encourages, and I'll talk about that later, that definitely encourages that we do get workers involved and that there be a good consideration for a system so to raise health and safety concerns, obviously through the Joint Health and Safety Committee. The other important point that comes in about involving the workers, often we forget about the role that other staff play with it. So for example, maintenance staff, don't forget, if you're looking at a particular job, somebody may be coming in later to do maintenance around that particular equipment or around that work. So you do want to loop in maintenance staff, engineers that are going to be ordering or designing particular pieces of equipment, and procurement, because they can make the decisions they make obviously are going to affect how the work system, and it has a great potential and in many cases underlooked potential for improving workers' health and safety. So I just wanted to briefly cover the importance of early reporting. I mentioned that earlier. And, in terms of the regulation, it talks about the MSI signs and symptoms. People don't, an easy way to sort of think about the difference between signs and symptoms. A sign is something you can observe. So you can see redness, swelling, limited movement of the body, of a particular body part. That's sort of clearly a physical sign. Symptoms is more associated with some of the discomfort you're likely to feel, but that's pain, joint stiffness, muscle tightness or weakness, a feeling of pins and needles, numbness, or a burning feeling. And so that's the sort of the way to differentiate between a sign and a symptom. But either of them can appear suddenly, or they may appear gradually over time. And that's why there are other names for other than just musculoskeletal injuries. One term you might hear is cumulative trauma disorders. Well, that's reflecting the fact that a lot of MSIs, it doesn't happen on one day. It's that accumulation of that either repetitive motions, the effects of the repetitive motions over time. And so it's not likely to appear suddenly. In that case, it can, but it's more likely to appear gradually over time. And that's what makes it quite difficult to be aware that it's actually happening to you. Sometimes, you want to emphasize to all your employees not to ignore the early signs and symptoms of MSIs. You want to make sure that workers know how to report their signs and symptoms. And in particular, they need to seek treatment to prevent the injury from getting worse. And the word treatment maybe is perhaps not quite the right word there. Yes, you might need treatment. I'm not suggesting otherwise. But you also want to let your supervisor know, because if you have an ergonomist on staff, they can come and you can consult, the supervisor consult about things that might be able to be done and we'll be talking about controls later, that to stop and prevent that injury from getting worse. And in my consulting capacity, I did a lot on return to work. And getting people back to work is interesting from an ergonomics perspective, because ultimately what you're doing is making the interventions that probably should have been done in the first place so that somebody didn't get injured. So you're actually being preventive by going out and working with an employer or a worker to get them back to work. You're actually helping identify the things that can be done to control the risk of MSIs. And as you can see in that large blue text, report signs and symptoms early. If a worker experiences signs or symptoms of an MSI, they should report it right away and seek further medical attention. So this is just covering some of the points I've already made. The earlier the worker identifies and reports the development of injury, the better the chance of recovery. The sooner the concern is addressed, the better the chance of recovery will be quick and more complete. And as we've talked about, involve the workers. And these are, again, a couple of questions you want to always think about. It doesn't matter if they're got discomfort or not. You might want to find out before even any discomfort occurs. You want to ask the workers what work tasks they are doing that make them think twice about coming to work. Or equally, you might want to ask the workers what jobs they are doing that make them feel stiff and sore. That's very important information, and it's often overlooked. It's easy to get, and I think it's important to get. So keep that in mind as a tip. Again, just emphasizing we want that early reporting, and we want to fix the problems soon as we can. So the ergonomics regulation, I'm not going to spend a lot of time on this. You're welcome to read the regulation, and there's all sorts of excellent resource materials if you want to know more about it. But the key point I want to make here is that ergonomics is participatory. And section 4.53 of the regulation recognizes how important consultation is in preventing musculoskeletal injuries. And it actually puts requirements on the employer. And you can see the employer must consult with the joint committee or the worker health and safety representative with respect to risk identification, assessment, and control. And that is actually the risk management approach for MSI prevention: identification, assessment, and control. And I've got a slide to put that all together for you in a minute. And then you want to evaluate the compliance measures that are taken. And then the employer must, when performing a risk assessment, consult with workers with signs or symptoms of MSI and a representative sample of the workers who are required to carry out the work being assessed. And in terms of a graphic slide, this is where it all comes together. You'll notice that we've got consultation running right down through each one of those components. Consultation is important. I just made that slide go away again. And you can see these numbers here. So we're talking about, when we talk about these components, education and awareness, risk identification, risk assessment, control and implementation. And we've got training and then evaluation. And you see together, they all go to MSI prevention. So that, if you want to have a model, if you want to just think about what the regulation is saying, that sort of graphically displays the importance of the MSI regulation for risk management and particularly of MSIs. So this is the fun part, I hope. This is what I'm going to try and convince everybody that MSI risk control is Jenga in reverse. And most people, I think, have maybe played Jenga and have a lot of fun doing it. Summertime is a great time, you know, depending where you are. If you're on holidays, great time to have a little easy to carry Jenga box with you, and you can enjoy it. But the concept that's important, and the reason I'm using and illustrating Jenga, is that, as you all know, in some ways, MSI injuries are similar in some ways to the situation described in accident causation theories, where, just like in Jenga, a series of occurrences lead to an unwanted event because that block of that was solid is all of a sudden there are holes in it and the Jenga collapses on the table. So my point is that if we can identify the risk factors and we identify them as early as possible, what you're doing is you're filling the gaps that exist in the world of work. And if you fill the identified gaps, MSI prevention and risk control can become Jenga in reverse. And this approach and this concept is obviously consistent with the general safety management process of continuous improvement. I mean, the reason why we're looking and talking about continuous improvement ultimately is to be able to identify and fill the holes so our Jenga block doesn't collapse. So hopefully that sort of graphically is going to illustrate what we are trying to do when we're identifying risk factors and putting in interventions. The important point there is every time you fill one of those holes, you are actually reducing the risk of MSI. It may not seem that significant because you're just filling one little hole, but once you keep doing that on a continuous basis, you're going to be filling many of the holes, and that makes your hole structure much stronger. Depending where you're filling, that one may not be critical. It might be low-hanging fruit, but if you look down into this situation here, I sure would want to, if I could, identify those holes, what they are, and I would want to know how to fill that gap. Another important concept, and it's in section 4.50, states that if MSI risk factors are identified, employers have to eliminate or reduce them to minimize the risk. And to effectively lower the risk, one needs to consider the hierarchy of risk controls. And it's a very important concept that applies right across safety. The most effective control options are at the top, elimination. And that's why it's called a hierarchy. You start at elimination, that's your first emphasis, and then you work down, because the least effective control is personal protective equipment. Now, I'm not saying that that's not an important consideration, but I am saying if you can eliminate the risk, that's much better than trying to either have an administrative control or personal protective equipment to control the risk and stop an injury from happening. So elimination comes first, then substitution, then engineering controls, and then administrative controls and PPE are important. You can't, often if you, for example, put in an engineering control, you still may need administrative controls to reinforce the aspects of that engineering control that's being used. But it doesn't mean that these aren't part of the system. It just means the most important controls are elimination, substitution, and engineering controls. And what I find challenging about the sector that you're in, when I think about things you can do to eliminate, substitute, or even engineering controls in your sector, they are very, very difficult. So at this point in time, I'll be talking about this later. We're going to probably have to spend time initially looking more at administrative controls and potentially PPE. I can't think of examples there, but there will be cases where PPE is going to be required. So as I say, when I consider the hierarchy of controls and think about the world of work, in your sector, the difficult ones to implement are, elimination and substitution. One would unfortunately have to say it's unlikely. So that leaves us for our discussion around controls to be talking about engineering controls and administrative controls. Engineering controls of physical change. You want to adjust and adapt the work environment and or equipment to eliminate or minimize risk factors. The administrative controls, this is where I unfortunately think we're probably going to have more of a discussion. There are things that can be done from an administrative side. You want to look at scheduling, task variety, education, training, and organizational support. So in trying to think of examples of engineering controls, I couldn't think of any that I was aware of because I haven't been working yet as much as I would like into the community and social services sector. But I went to the healthcare sector to say, well, what do they do for engineering controls? And I realized that these controls would be extremely difficult if not impossible, to implement within the community and social sector services. But that doesn't mean we shouldn't be aware of it. So you can see here that we have various types of controls, engineering controls, automated repositioning systems in the healthcare sector, long-term care. You can get floor lifts. They might be a possibility, although not that practical in community and social services, unless the home you're going into actually had that there already. And they've got automatic turning of patients to control the amount of physical lifting they have to do. So with that difficulty, even with engineering controls being in mind, as I mentioned, that leaves us with the situation of where if elimination isn't possible, substitution and engineering controls are challenging. That leaves the next level as the administrative controls. And I was thinking about how can and what can we do? You'll notice here that this is about a worker and resident safety, and you can see this particular system. It's got that continuous improvement approach to it. It's like plan, do, check, act, or any number of systems like this. But you can see that they talk about engineering risk controls. Well, that's difficult. Training, coaching and supervision, resident and family education, and then point of care assessments. So I'm going to be explaining a little more about that, but it struck me that an excellent source of information to optimize the physical requirements of transferring people is to look at the information on transfers developed by experts in the healthcare sector. And I know they've done a lot, and you know, as an ergonomist, that's outside of my realm of expertise, but at least I wanted to acknowledge that they have done a lot of work around these administrative controls. And if it's not happening already, I'm sure that there will be an open sharing of information when talking to experts in BC's health authorities about how they deal with their resident handling. But I wanted to move to this next slide because it's a little more specific. It's not a diagram. It's something that actually the Vancouver Coastal Health has developed. They have a point of care risk assessment system. And what I particularly like about it is that it does convey that component theory that we were talking about. You can see that there's a person in care as part of their work system. You've got the tasks that are performed, the worker themselves, and the environment. Those are all very, very important aspects to it. And if you want, in my view, to sort of look and move towards administrative controls, this struck me as being sort of an excellent model and concept that could allow some really good discussions for within your sector about how transferable some of the information is. Maybe, and as I say, you may be doing this already, I hope so, and how transferable their knowledge is over into situations that you're faced in your sector. So that leads me to the last section, which is of my presentation, some of the resources and tools that are available to support you in your musculoskeletal injury prevention program. Now, WorkSafe BC, where I work, has got a lot of resources to help workers and employers reduce the risk. We produce our ergonomics e-news biannually, and it's just an update of what's happening in the ergonomics world. But we do have a number of other publications and booklets that are a great source of information to help you get started or to enhance your musculoskeletal injury prevention efforts. You'll find tips and strategies to identify and control MSI risks in the workplace. The first book is Understanding the Risk of Musculoskeletal Injuries. Most of the information, you know, is similar to what we shared today, but it guides you through the steps and provides all the materials to help you get started with educating workers. The second booklet is Preventing Musculoskeletal Injury, is a guide for employers and joint health and safety committees. It lists more information to help identify, assess, and effectively control MSI risks. One of the obvious difficulties with information like this, it is by its very nature, because it's applying to all sectors, is quite general. So one of the challenges you might want to take on is to say, what can we do by working on and using these books as sort of a format, and then how specific can we get to applying it to situations that occur in our our sector. And I think that would be an exciting project. The third booklet is one that I was directly involved in. I haven't talked about office ergonomics and the setup of computer workstations. I know a lot about that area. I have just been involved in the publication of this newer document. The document itself, How to Make Your Computer Workstation Fit You, has been around for a long time. But it's now updated. And for instance, we didn't have any mention in there of standing workstations. And so that was definitely items that have been added. And if you want to watch a fun video about manual materials handling and how to eliminate and reduce risk related to lifting, locate the Blue Man, what we call the Blue Man video. You can find these resources. The website page is listed there, and it hopefully is easy for you to locate. You'll also find we have MSI prevention guidance information sheets. They're on pushing and pulling, contact stress, and cold temperatures. It's useful information, but again, the question that needs to be answered is how relevant are some of these pieces to your particular situation. So again, one would hopefully be able to take the general aspects of these guidance sheets and tailor it specifically to your sector. I wanted to acknowledge as well these childcare resources, because it's the information sheets that I thought might at least give some ideas for situations that may occur within community and social services. And you'll see the web link is at the bottom. It's the same with the ergonomics, but if you look for childcare resources, you'll actually find some excellent publications that Gina Valla, who is an ergonomist at WorkSafe BC, she's developed these and she covers lifting and bending, storage, eating areas, indoor activities, outdoor activities, coat rooms, toileting, changing diapers, sleep and rest time, and stress and noise. So again, these are great for stimulating some thoughts about situations that you might be encountering and ways that you could maybe think about, gee, that's a good idea. Can we do it in our situation? We do have some other tools. I just wanted to mention a couple of them. We do have a tool for a risk assessment for lift and lowers. We're moving towards a little automation. So this is done on the computer, and it will give you values. It gives you a calculated value. You do have to be cautious here because they're looking at it for a petite female and whether a petite female can actually handle these loads. That's great for designing tasks, but if you actually applied it to the real world of work, sometimes you're going to get a result that is much lower in what you can lift compared to what actually happens in the world of work. I also wanted to draw attention to our Guide to Musculoskeletal Injury Risk Assessments. These are worksheets, and you go through the worksheets and answer a series of questions, and that should help guide you. One of the projects I've been working on is actually automating those sheets. It's called ErgoCheck. We've actually got a web-based version of it, and it calculates an MSI risk score, and it lists MSI risk factors in priority order. So if, for example, you had an ergonomics subcommittee, or if you had a joint health and safety committee, that type of information might be really helpful to them because it's going to let you know where the bigger gaps are. And ultimately, I'm hoping this can be developed to a point where we can get more specific about controls that are going to be used. And in that context, I mentioned earlier about the publications WorkSafe has. We are constantly updating, and the one on prevention is going to be updated. That's what I'm going to be working on over the summer. You'll note that if anyone's interested in ErgoCheck, I'd love to show it to them. And we are looking for an employer to perhaps evaluate it because we're in the beta stage of testing. Currently, it's out with 6 employers. We have room for a couple more. Other jurisdictions, there is a lot of information. I'm not going to list them all there, but they are available, and I'm sure you know them all. So in summary, the takeaways that, the ergonomics approach increases efficiency, health, morale, and productivity in the workplace by helping you understand the interactions in the work environment and preventing MSIs in the world of work. Success comes from working with and involving the people who do that work. It helps you understand problems and develop the best solutions. We want to work together to ensure there's a process for workers to report signs and symptoms before they develop into long-term health effects. And the last point, obviously, in eliminating or reducing risk factors, start at the top of the hierarchy of controls to effectively eliminate or reduce MSI risk factors and contributing factors. So having said that, if there is time, and I'll turn it back to, and I guess, or maybe they can just ask the questions to me directly. This is my contact information. But Anna, do we have time for some questions?
Yeah, we do have time for some questions. If folks have any, by all means, please put your question in the chat. That would be great. I got to say, Jeff, this was a very, very good presentation. There's a number of themes that I was kind of particularly looking to, and you really hit them quite nicely. And what's important is community social services is a very poor industry. And we're always trying to do more and more and more with less and less and less and even little. And I think MSIs is such an integral part of just sort of the injury aspect of the type of challenges our workers are facing and our employers are trying to manage in this process. I like the theme of the early MSI approach for organizations. And, I think there's some information that I think that employers can pay attention to in that initial process. And also, I think that the Jenga analogy is fascinating. I mean, you don't think of it in reverse, but if you start to identify, particular gaps within, exposure to risk, and I love the fact that you talked about a hierarchy of controls and you talked about touching on the risk matrix as well, and employees being an integral part in providing guidance on that is just so critical. The world of work, as you put it, the different mechanisms and the exposures that are happening. In our sector, we're dealing with human beings. And so, to work in those environments, and internally, they're not within a structured environment in many cases. It's critical that we do the best we can by supporting our staff and understanding the dynamics of the kinds of things that we are dealing with the exposure of risk of the kinds of services and programs that we're serving. And I'm talking about anywhere from community living organizations and 24/7 operations in residential settings and birth to death. We're talking about immigrant service organizations providing very critical components, dealing with refugees, immigrants, also youth and family services, Aboriginal organizations, Indigenous services, while providing critical components, and harm reduction organizations on top of that. So, this is a huge breadth of, challenges that we have. And I think that your presentation really hit on some really good stuff that for us to start, percolating and thinking about, what are those potential external factors that are evolving around from a program standpoint and what can be done to the best of our abilities. So thank you.
Okay, I'm not able to see the chat right now. So are there any questions? And if there aren't, I'll just thank you for the opportunity of being able to present some of these ideas. And I do look forward to working with you and your organization going forward.
Thank you so much, Jeff. Really appreciate it. So I'm just going to ask you, Jeff, if you can close your window.
Yeah, so I may have to sign off because I'm not seeing that icon that I need. So I will be back.
All right. Okay. Thank you. And so I'm delighted to bring in Rick Walters now at this point.
It should just be in the bottom, Jeff.
Oh,
yeah,
okay.
I know it should be, but I'm
You
not
know what?
seeing it.
Here, I'm going to move this to.
Yeah, if you can do it from your end, that would be great. I don't know why it's not there.
There you
Here
go.
we go.
Oh, okay. So am I sharing now or? Okay, I think.
Now Rick will be able to share.
Okay. That's great. Thank you.
All righty. Thank you, Rick. The floor is yours. Rick, I'm afraid you're on mute. There we go. Let's see if we can unmute you.
Sorry, some of my windows have disappeared. So can you see my presentation now?
Yes, we can. I think you just got to press the play and we're good to go. Thank you.
Okay. Sorry, so I'm going to have to...
On the left, it should say from beginning.
Yeah, no, I wanted to, I've lost my WebEx window here. So. Well, let's not fiddle with that. If it's all okay on your end. Good morning, everyone. My name is Rick Walters, as Sat introduced. Thank you for the introduction, Sat. And I am the Road Safety Program Manager for an organization called Road Safety at Work. And guess what? We focus on road safety. We are an organization that's been around for about 15 years or so. A road safety initiative that is funded by WorkSafe BC and managed by the Justice Institute of BC. And really, we've been working with employers all across BC for a number of years now, and just really helping them improve the safety of employees who are driving for work purposes. This is driving me nuts. So today, I wanted to speak with you a little bit about why road safety matters, or really why it should matter to organizations such as yours. Sat's told me a little bit about the nature of the businesses that you're involved in. I've tried to think about the road safety angle, the considerations that would matter to your organization. There are a number of organizations in your sector. I've got a number of statistics and things like that that speak to kind of the status quo, state of the union, if you will, in your sector and in some specific classification units. I want to touch on legal obligations as well. There are some important legal obligations that apply to occupational road safety. I want to cover those off, but I also want to talk a little bit more about due diligence and best practices, and kind of based on the theme that satisfying basic compliance is I guess is a starting point in my view, but in terms of really doing your best and the most and the standard things that organizations are doing to ensure the safety of their employees whilst they are driving for work purposes, and the best practices that are part of road safety programs from companies around the world. Kind of there are some fundamentals, some basics, some best practices that I want to kind of talk to you a little bit about as well. And really the second half of the presentation is around road safety at work, what we do, the tools and resources and services that we offer. So I'm going to spend a little bit of time looking at specifically the tools that are available on our website. With respect to asking questions, by all means, I am hoping this is an interactive presentation. Hopefully some of the things I say cause you to sit up and go, hey, is that really how it works? Or cause you to wonder a little bit more about what the requirements are or how a tool might work. And then, so by all means, please enter your questions into the chat box, and Anasat will monitor. And I'm going to stop for 2 question periods here just to double check, one at the halfway point and then one a little further along. So I have to look at my notes here a little bit, but nonetheless, so this is why road safety matters, or why it should matter to organizations. Motor vehicle incidents are the leading cause of traumatic workplace fatalities. That's something, it's a fact that's not widely known by a lot of organizations, particularly organizations for whom driving is a secondary part of what they do. And that's okay. I mean, if you're unfamiliar with road safety requirements and the facts in front of you, you're like many other organizations. So we're going to talk our way through some of the things that are required and some of the things that you can do to address that. I find this fact a little bit surprising. When we think about safety in a lot of terms, and particularly in terms of fatalities, quite often folks think about falling trees or confined spaces or electrocutions, falls from heights as being a very substantial cause of fatalities and injuries in BC workplaces, and they are. But motor vehicle incidents are that leading cause, and that's why it's really important to pay attention to them to make sure it doesn't happen to your organization, your employees. And it's not just the impacts that those crashes have on the individuals, life-ending consequences are really immeasurable in some cases. The consequences of those crashes branch out to families, co-workers, friends, and things like that. And for some organizations, or the organizations that have employed those people who are killed in a motor vehicle crash at work, it can change their business fundamentally, and in some cases put them right out of business. So important to pay attention from the fatality perspective. But the other side of it, and I'll get into the numbers a little bit more here, is not just the fatalities, but the claims that are associated and lost work days as well. So in addition to being, not the most common traumatic workplace fatality cause, workplace fatalities due to a motor vehicle crash account for about 1/3 of traumatic workplace fatalities. So that's a pretty substantial, unfortunately, a very substantial share of the fatalities that happen to workers in BC. But as I mentioned, in each one of those years, between 2017 and 2021, there have been on average 20 work-related crash fatalities. That number has ebbed and flowed over the years.
Rick, I think you're muted again.
How about now?
Yeah, I can hear you now.
Oh, good. Okay.
But we did lose you for about 3 minutes, I believe it was. And thanks to Janice for bringing it to our attention. There we go.
Okay, so sorry about that. Let me go back. Where did you lose me?
I'd say about two, 3 slides.
So, just a second. How about this one?
I'm afraid it's not on the screen yet.
What's that?
The presentation's not on the screen, I'm afraid, Rick. Oh, the wonderful world of technology. What's happening out there in Williams Lake?
Electronically, not very much. Let me just go back because, okay, it automatically stopped sharing video. My apologies. With a little luck, you're seeing my screen now.
Not yet. Now we see it.
Okay. Well, I proceed to not bother with the overview. Questions don't need that one. How about a slide? I can pick that up if you like, or a little further along.
Further along, please. Yeah, further along. I think you just passed yeah, I think it was right after this one.
Okay, so I hadn't finished speaking about this slide specifically, so I'll do that. So the thing about the lost work days with respect for employers is that that number also has been changing. In fact, it's been increasing over time. Touch on why that's been happening over the last few years. So, you know, when I think about 100,000 lost work days across Work BC in the last little while, it's been 125, 135,000 lost work days as a consequence of a claim, someone being off work because of a claim due to a work-related crash. So when you think about that and spread that out over the 260 or so days that are in an average work year, that means that on a day-to-day basis, there are 500 or thereabouts people that are missing work because they were involved at a crash at work. So not inconsequential at all. In fact, very large consequences. You might be thinking that a lot of workplace crashes involve people for whom driving is their primary role. Something they were hired specifically for their driving abilities. They're truck drivers, delivery drivers, couriers, people like that, for whom driving is what they do. And they might maybe behind the wheel for 8, 10, 12, 14 hours a day. So that's a very full day. And a lot of those crashes that we talked about a moment ago, certainly they do impact people in those sectors. Literally the number of exposure hours that hours of driving related hazards that they're exposed to really just increase the likelihood of them being involved in a crash. And so absolutely those are sectors and people who are involved in crashes. So even though they have the driving skills, they have the driving experience to deal with the hazards that might encounter, those exposure hours really impact their likelihood to be involved in a crash. But the other side of these crash statistics is that they also involve a lot of people for whom driving is really a secondary part of what they do for work. They were hired for skills, as you can see here, for as nurses, community and social service workers, paramedics, housekeepers, nurses, folks like that who were hired for those other skills, but in the process of doing that work, they do a little bit of driving. Maybe they start their day with a drive to a client's house, or they drive during the course of the day to patient locations or to a meeting or things like that. So it is a secondary part of what they do, but it's also part of their work, and there are certainly hazards that they're exposed to while they're driving. And so a lot of the statistics that we look at in road safety include people for whom, we might not initially think are involved in these crashes, but certainly that's the case. And one of the things to consider, if those are the sorts of employees that you have, is that there's a pretty solid body of evidence that suggests that on a per exposure hour basis, people for whom driving is really an occasional or a secondary part of their work, they really have a proportionally greater risk of being involved in a crash. So, maybe they don't have the driving skills, the familiarity, the practice, their skills are a little rusty. Maybe the organizations don't have processes in place to manage the risks and the hazards for their employees. So, proportionally they're exposed or they're exposed to the same hazards and are proportionally at greater risk of being involved in the crash. So something to keep in mind in that regard as well. Another thing to bear in mind with respect to motor vehicle crashes is that these claims associated with a motor vehicle crash at work, they can cost more and they last longer. That has direct implications for the employer and the employees. So when you think about that in terms of all of the claims, or compared to all of the claims that WorkSafe BC experiences, they're on average cost about $30,000 per claim to make that employee whole and get them back to work. If and when an employee is involved and injured in a motor vehicle incident and are off work and on a claim, that claim lasts that much longer and costs that much more. So in terms of managing incidents in your workplace, if you, in the grand scheme of things, if you can take the opportunity to find ways to prevent a single crash, dollars for donuts, that's going to have a greater impact than preventing another incident. The other thing to bear in mind is that, duration even of 65 days for all claims is substantial enough. And these days, difficult to find employees and keep them on the job. But from a motor vehicle claim perspective, looking at that 84 days, that's now approaching, 4 months of work days that they're gone from work. And bear in mind that if you have an employee and when an employee is off work, the longer they are away from work, the greater the likelihood is that they will not return to work, find something else to do, different job, those sorts of things. So return to your workplace. So again, in terms of employee retention and hanging on to the good workers that you do have, making sure that they're not involved in a crash at work makes an awful lot of good business sense. Looking a little bit more closely at claims in subsector 7660, which I believe most employers on the call are in. You can see that there has been a substantial change in the number of crashes and the cost of those crashes over the last decade or so, but more specifically within the last few years. So, looking back across 2012 to 2018, there was a range of from 184 to 263 claims related to a crash at work in subsector 760. I think the average there is about 230 claims for those years, and the average claims cost associated with those claims during those years was about, sorry, not the average claims cost, but the total claims cost was about $2.1 million. But in the last 3 years, 19, 20, and 21, those numbers, as you can see, have changed substantially. So moving upwards from 281 to 310 to 500 plus claims. And the costs have also skyrocketed from, that average of about $2.1 million to now an average of $3.7 million. And those costs are borne in some regards directly by the employer. The real costs borne by the individual who's injured, but there's costs and consequences for the employer. And then those costs are also borne by the classification unit and the sector as well. So, 60% increase in the number of claims and a 75% increase in the costs associated with making those people whole again. I tell you. Looking a little bit closer at classification units 766007, 766010, and 766017. So compared to some of the data and looked at the assessable payroll for these classification units, and then thought about the number of crashes, incidents that have been, and claims that have been made by employers in that sector, or sorry, those classification units. So when you look at those numbers, the historically, the assessable payroll of those three classification units is about 13% of the total assessable payroll for that sector. Fortunately, during the same period, those three classification units were responsible for about 23% of the motor vehicle related claims for the sector. One of the things that has done for, particularly in the last few years, I think, is employers in these classification units have experienced significant increases in the assessment rates, the fees that they pay WorkSafe BC, but also think about the impacts that has on the company's bottom line. It's not just the increases in assessment fees and whatnot. It's the costs of lost productivity. It's the costs of missed appointments. It's the cost of replacing or repairing of the vehicles, the cost of cost of reputation to the organization itself. In some cases, safety records have had implications for bidding on contracts and things like that. So it's not just the money, and it's not just the injuries to employees. It has further implications for the organization itself and their employees and their families as well. So part of finding success in road safety is, and we're going to start on kind of understanding the health and safety requirements. And most of what we focus on clearly is requirements under the Workers' Compensation Act and the Occupational Health and Safety Regulation. But there are certainly legal obligations identified in the Motor Vehicle Act and its regulations as well. So we're going to focus on occupational health and safety requirements first and foremost. So those statutes, WCA and the OHSR, really focus on workplaces. So workplaces, as you can see, is defined as any place where a worker is engaged in work or is likely to be engaged in work. So any vehicle that is being used for work purposes is indeed a workplace, whether that employee is driving to a patient's home, transporting a client to a work location, going to a meeting, running downtown to pick up supplies. If driving is part of what you, the employer, has asked them to do, it's work, and the obligations we're going to talk about apply in those situations, as do the statutes. There are a number of requirements stated in those statutes. The three I'm going to focus on are, first of all, the overarching requirement that employers ensure the safety of their employees, their workers. The other one is to make sure that the employees know about the hazards they might encounter, particularly when they're driving, and what to do about those hazards. And the third one is to legal requirement for the employer to provide the information, training, and supervision that the employees need to successfully carry out their work. The Occupational Health and Safety Regulation goes into a little bit more detail about workplace inspections, evaluating and managing risks, having safe work practices, inspecting work practices as well, looking at what procedures your employees engage in whilst they're driving for work would be an example. So those obligations that you apply across the rest of your workplace apply equally when your employee is driving for work purposes. I'm going to clarify quickly here about white fleet and gray fleet. You may have heard people using these terms, referring to the white fleet as vehicles that are owned by the company, the employer, and used for work purposes. Owned, leased, maybe even rented in some cases, but it's done by the company, the employer. Another term that's been around is the gray fleet. And those are vehicles that are owned by the employee themselves and used for work purposes. Over the years, I've had a lot of questions about, so I've got my white fleet over here, and I'm doing these road safety practices. What are my obligations, my responsibilities to the gray fleet and the people who drive their own vehicles for work? And I tell them increasingly that the gray fleet is really a misleading term. There's no part of the regulation, no act, no policy that WorkSafe BC has that kind of differentiates safety priorities or excludes or changes the requirements for based on who owns the vehicle an employee is driving for work. So that's great in one hand because having any sort of a differentiation between the safety of one individual compared to another based on who owns the vehicle they drive really doesn't demonstrate appropriate value in or employer value for the individuals themselves. So, keeping to that one set of safe driving policies, practices, and procedures demonstrates that the organization values the employee equally, regardless of whose vehicle they're driving. It's operationally efficient for the organization as well. And the challenges, I would suggest to them, possibility of running essentially two sets of rules, one for a white fleet driver and another set of rules for a gray fleet driver, operationally inefficient and really impossible to implement. So those rules, those regulations apply, those expectations apply equally no matter who owns the vehicle that an employee is driving for work. I'm going to pause there. Any questions, Sat? Ada, that you can see that you'd like to bring up about any comments about the regulations and things like that?
Yeah, no, this is really, really helpful and very important information. I didn't know that we had such a large group of staff that are in this purview of, incidents that are related to MVIs in the workplace. I think that this is really important because of, organizations provide various levels of services throughout the province in very different capacities and even have more challenges that are further away from the metropolis areas. And so this is really important and helpful information. And I always thought about that whole concept of, the gray and white fleet too. Like, what is the delineation at the end of the day? But really, it's following the legislation to the best of your abilities and being clear on the purposes of, safeguarding and providing good training and education for our staff in this process, which I think that you're going to speak to as well.
Yeah, absolutely. Yeah, and you're not alone. There are many employers, many employees that feel there is some difference. That for example, I'm driving my own vehicle for work today, and my employer doesn't own the vehicle, so they have no authority to tell me how to drive it, where to drive it, what it needs to look like, and that's not true. When a vehicle is being driven for work, the employer has every authority to specify the safe work procedure, specify the condition of the vehicle, have the employee inspect it and maintain it to a certain standard. So yeah, and that's kind of a light bulb moment for a lot of organizations and a lot of people.
Well, I got to confess, I mean, in my former life working in community living and immigrant services and harm reduction, our staff did a lot of work. They were out and about, whether supporting individuals, helping street entrenched folks, or even engaging in the transportation of biohazardous goods. It's something that it's there, but as organizations and community social service, we're so inundated with just the delivery of the program, and we sometimes and all legitimately. We've just got too many things going
Yeah,
on. And I think these are things that, the purpose of your presentation is to bring it to light and to access your resources to provide supports as well for our sector.
yeah, absolutely. Okay, well, maybe I'll venture on then with the next slide, and just as you mentioned, so what can we do about that? I can offer up several suggestions in the next series of slides here, and really specific things that you can do to improve road safety across your organization. And really, I think the biggest thing for particularly for organizations who don't have an awful lot of practices or control measures in place is to simply start talking about road safety. Make it a topic of discussion throughout the organization. There's a variety of ways that you can do that. If let's say your human resources, for example, and common occurrence, don't necessarily have driving qualifications as part of the hiring criteria. So you possibly are bringing on board employees who don't really have a full appreciation of what sort of driving they're going to be expected to do whilst they're at work, and conversely the organization not having a good clear picture of what sort of driving knowledge, skills, behaviors a new hire has. So making that part making road safety, talking about driving, et cetera, as part of the onboarding process is something that you can really have a powerful impact in setting the stage and identifying expectations and identifying gaps. So start by talking about road safety. Maybe during the onboarding process, you have a manager, the owner of the company, someone with some influence. Sit down and talk with that employee about, okay, so this is a safety culture in our organization, and you've got other things and other elements of safety that you want to talk to with this new hire, but add to that conversation things about, and in road safety, this is how our organization addresses road safety issues, and this is how we will expect you to behave, and et cetera. And it doesn't need to even be as formal as that. Bring it up in a coffee room. There's opportunity. We've all had a near miss or seen a near miss or something like that. Those stories, sharing those stories, those road safety moments, and talking about things that, gosh, as a new hire, you might encounter one of these, and here's what I did to make sure it, avoid that and make sure it didn't become a crash. Sharing those stories in the coffee room can be a really easy thing to do. A little bit more structure to it. Tailgate meeting guides are something that the Road Safety at Work team has developed. We've probably got close to a dozen of them. They deal with topics ranging from reversing and parking, hydroplaning, winter driving, avoiding aggressive drivers. And the idea behind these guides is to give you a one-pager that a supervisor or anybody in the organization can pick up and use to lead a discussion about any of those safety or road safety topics that are going to resonate and be relevant to employees who drive for work. One of the other things you might consider doing is sitting down next safety meeting, listening to and watching one of our on-demand webinars. We've got 20 or so, well, it is 20 now, webinars that we've recorded over the years and range on topics from intersection safety, avoiding collisions with wildlife, something that's highly popular with employees who do a lot of driving in rural locations, distracted driving, another one. There's about 30 or 40 minutes of, I think, pretty good content in those each of those webinars. Sit down, start the conversation, start talking about road safety and engaging your employees in those conversations. So once you get underway, you've got started on your making road safety a priority in your organization and making it part of how you do things. The next thing to do is to think about your road safety plan, your road safety program. So as you know, employers are required to have a safety program. that is aimed at preventing injuries to employees. So that includes injuries they might receive whilst they're driving a car or truck, or even those elements need to be incorporated. Road safety elements need to be incorporated into your overall road safety program. This is, as I mentioned, something that's going to be new to some organizations, and recognizing that, we set about building a tool that we thought could be useful for organizations, kind of regardless of where they are in the spectrum of, just started road safety, all the way up to those organizations who have, best in field industry standards and beyond road safety programs. So we've developed something called the Road Safety Plan Template. And so with those objectives in mind, we developed it kind of in a stepwise process and an a la carte approach as well. So I'll explain a little bit more about that as we go through this. The Road Safety Plan Template document itself is a downloadable Word document. The link here will take you to that. It comes with instructions and directions about how to use the template itself, considerations that you may have. There's a few introductory pieces, like an overall safety policy example that you can use if you haven't already got one. Roles and responsibilities, quite often in an effective safety program, identifying those roles and responsibilities is important, so everybody knows who's responsible for what and when. So a bit of a framework, again, that you can use to apply strictly to your road safety plan or to your overall safety program as your want may be. The other thing that we wanted to do with the road safety plan template is build something that gave employers the ability, rather than now creating, if this is road safety is new to you, creating a brand new road safety plan, something that's an additional process or procedure. Instead, we kind of wanted to, well, not kind of, we very much wanted to build a tool that employers could use to integrate into their existing program. So we think that the road safety plan template checks most of those boxes, all of those boxes. So we encourage you to have a look at it and download it, have a look at it, and put it to use. The other thing that I wanted to mention about this is the associated matrix. So within the road safety plan template itself, all of these elements and measures, I guess is probably the best thing to call them, are identified in the road safety plan template. Work through it in stepwise manner, and there are links to the resources that you can use for every one of these elements. So we're going to talk about selecting, choosing which ones to go with first, but it's important to know that in the road safety plan template, you've got a way to access resources that can help you with every one of these. So it's not just, oh, let's conduct driver orientations and leave it to you to figure out how to do that. We've got a template and in fact an orientation checklist that you can use. So let me just kind of break this down for you a little bit in the next few slides here, and then we'll get on to some of the next items. So across the top of the matrix itself, building your road safety program, are 9 elements. First one there, confirming that drivers are indeed qualified to do the driving that you expect to assign them. One first step. Making sure employees have the necessary driving skills, knowing that they can safely do the driving, have the skills, the abilities, the behaviors to safely do the driving that you're going to assign them. Knowing that not only the employees know the hazards that they may encounter, but their supervisors and the managers understand those hazards and what to do about them. Policies and procedures, as Jeff mentioned, there are a series of very, very effective, and we prioritize them in the road safety plan template, policies and procedures that organizations should have. Journey management, a very effective way to reduce risks, and we'll look at a few of the tools that we've got to help you not only think about ways to eliminate unnecessary driving or substitute travel methodologies that have less risks, and ways to manage the risks for those journeys, trips that your employees must take. Fifth element there is the using safe vehicles, inspections, maintenance, vehicle selection, and then supervision, as well as communications, and keep on getting better. As I mentioned, road safety plan template is aligned with this matrix, and you can tackle any of these elements in the order that works best for you. So flexibility is part of what we think the road safety plan template can help you accomplish. So just to have a look at the other part of the template and the matrix is that we've built it in a basic, better, best framework. And the idea behind that is you know, some folks are just getting started, some are well into it, and some have best in class practices. So the one thing to keep in mind with respect to this structure is that in the basic row, there the items, measures identified in there tend to be aligned with basic compliance requirements. So checking for licenses, conducting orientations, and so on across the field, things that are required or versions of that requirements, either in the occupational health and safety regulations or in the Motor Vehicle Act, etc. Things over in the better row are, some of them there are a blend, I guess, really of legal requirements, and then moving ahead to, you know, do a better job of satisfying your due diligence requirements and meeting, you know, having moved on from the basic compliance, complying with the more challenging elements of some of the road safety requirements. And then the items in the best row are more about best practices, and again, things that you aren't specifically required by a statute to do, but things that we've found in road safety programs and the ISO standards and ANSI standards and things like that, things that really are fundamental components or at least part of you know, successful road safety programs. So that's kind of the progression of basic, better, and best through the matrix. So it gives you an option of you know, kind of starting with the basic and building on that, and then building on that again as you improve and implement your program. So here are the links to the road safety plan template. Your road safety plan is an important part of the Road Safety at Work website. I encourage you to go there. You will find the road safety plan template there. So with those links in mind, the next thing I want to do is talk a little bit more about some of the more specific items in our website. So this one is a screenshot of one of those pages about, this one's about checking driver's licenses records. So you can go across, I've just provided that screenshot, just to give you a little bit of a sense of the navigation. When you get to the Road Safety at Work website, look for that Tool and Resources tab in the upper menu bar there, and then use that drop-down menu, and in this case, looking for the driver license and record. Find the Assessing Drivers menu item, and when you click on this, you'll magically arrive at this page in front of you here. So on this page, in those drop-down accordions, there's certainly a few words about how often you should check driver's license, what the standards are, what the requirements are. There is some guidance around how you might want to do that, when you might want to do that. Next drop-down menu is reviewing driver's records or driver's abstracts, as they're called. Not only when you might want to do that, what considerations you might want to, what things you may want to consider as you're thinking about how often to ask drivers for a copy of their abstract. Some companies do it annually, some companies do it much more frequently than that. So the other thing that's in that tab is so do you do when you see a driver's abstract, employee driver abstract that has 3, 6, 9, 12, or even more penalty points? What implications does that have on, whether you can safely assign them any driving for your organization? And if so, are there any limitations on, given they've accumulated that many penalty points, are there some additional risks? Are there some types of driving that you may not want them to undertake? Passengers are very valuable cargo. Do they have driving habits that suggest to you that, that they're not speeding or engaging in other risky driving behaviors? So a little bit of information about how you may want to interpret what you see on driver's abstract. And there are some ideas there about checking insurance. So if you have an employee who is bringing their vehicle to work and driving it for work purposes, what sorts of insurances should you require them to have? So that's there's some guidance in that regard there. So several of this is kind of a look at our website, and several of the pages are constructed in this manner. The other one that I wanted to talk about, I'm trying to think where this one is. Oh, this is the second item, or the better action under the confirming drivers are qualified tab. So that action item is to do periodic driver assessments. Very important to understand what sorts of skills, behaviors, etc. employees have, and how they are driving at work. So Skill Check is a tool that we've developed in conjunction with the driving instructors over at GIBC, and it's based very closely on the processes and the mechanisms they use to evaluate drivers, themselves being driving instructors. We've compiled Skill Check into a fillable PDF scoring form is one of its features. 20 different criteria about things an assessor is going to look for when they're evaluating a driver's behavior. And along with that is a comprehensive guide that identifies, explains questions that you can ask of yourself or of the driver themselves when it's safe to do so. Just kind of verify their skill level and how much they know about the driving they're doing. To support that, there's a 3-part video available on the website. Goes through the whole process from start to end, organizing it to the begin, having the initial conversation, getting underway, the video elements of exactly what you're looking for or not looking for in some cases when you're doing a ride-along assessment that way, and then the wrap-up piece, giving the feedback back to the driver. You did this very, very well. You didn't do so well over here. Let's think about how we can work together to improve your reversing practices, or you follow too close. What are we going to do to change that? So to support that is a 3-part video, and there's also a workshop that you're welcome to sign up for, and a free online course that we've just dusted off and implemented. So all of those things are tools that are available to you to help you succeed in conducting periodic ride-along assessments and finding out what skills, what knowledge, what behaviors your employees have when they're driving for work, so you can judge what needs to be, if anything, improved. Another one of the tools that's, I think I'll work in our way a little bit further to the right on that matrix. This one is, I think, the first element in the understanding the hazards that employees, sorry, it's the second one, the hazards that employees encounters. The basic measure, as we talked about before, is simply talking to employees and the Occupational Health and Safety Committee about the hazards they encounter when they're driving to work. But getting a grip on what conditions they feel is most dangerous, and what conditions they feel are most dangerous, and then even thinking about what are the things that they are already doing to manage the risks that are associated with hazards that they encounter. So in the better row, second row down, is the risk check tool, and we've constructed risk check with the idea of doing annual risk assessments, whether it's your management team, Occupational Health and Safety Committee, a few drivers, or really probably a combination of all 3 of those, so that it's an efficient assessment process, and using risk check to do those annual risk assessments. So this tool is it's purpose built, focuses clearly on road safety items, structured so that it kind of steers you through the whole process and gets you to the end in a stepwise manner, but one of the first steps is the customizable hazard inventory. We've developed a list of about 40 or so different hazards that people commonly encounter when they're driving or driving for work. So you can identify all of those hazards. You can customize it in that you can change the hazards up a little bit. You can add ones that aren't there but are very real for your employees. And you can also delete any of the hazards that don't apply to the situations in which your employees drive. After that, you move on to a very simple risk matrix, probability, severity, in which you decide really on the ranking of each one of those hazards in terms of risk. From there, the tool moves you through to a series of recommended control measures. You've identified distracted driving as an item, as most organizations do. So what can you do about that? That's the recommended control measures part of it. What can you do? And so carrying on longer than I should. Yeah, I will wrap up in a moment here. So those things then move you on. Like other tools, we've got resources that will help you build and implement those control measures that you've decided on. And the tool kind of wraps everything up in a way that gives you a very shareable, concise plan for what you're going to do. And it gives you the opportunity to assign particular target dates and assign specific actions as far as implementing or building those control measures to individuals. So encourage you to have a look at Risk Check. Similarly, it's supported by workshops and a few other online resources, including a video on our website. So tools to help you and tools also to support that. In the interest of time, I want to talk quickly about policies and procedures. One of the features of our recently renovated website is that we've included a wide range of policy/procedure templates. All follow the same format, but they're going to help you, come up with your policy, your procedures that are going to work best for your organization, your employees. But we prioritize them in the matrix in ways that will help you, first of all, look at your safe driving procedures or your safe driving rules overall, and deal with distracted driving, speeding, aggressive driving, impairment, fatigue, those kind of the most common road safety issues that contribute or cause crashes in the workplace. So having policies and procedures around those topics in particular get you started, and then as you proceed through better and best, other policies that you'll want to add along the way. Trip Check is mentioned that journey management is a very effective way, a really effective opportunity for reducing risks. Another online tool really focuses on helping when driving is necessary, helping drivers and their supervisors plan trips in ways that manage the risks and first of all, identify the hazards and manage the associated risks of things that they are going to encounter along the way. So this is a tool. It's free. It takes a few minutes to complete, but it's really alerting the driver and making sure that the driver has prepared their vehicle and themselves for the journey ahead. And it's a tool that can be used with equal effect for rural trips, for people who are driving in remote locations. But there's also people who are driving in very urban settings who are exposed to significant risks. So using Trip Check tool is a handy way to do that or manage those. Talked a little bit about vehicles and inspection processes, maintenance, and a vehicle selection process. Off to our website, we've got example templates, forms that you can just print off and use for inspecting vehicles in your organization, some ideas around maintenance. And the other important thing about the vehicle inspections is that their impact as a cue. So before the driver gets behind the wheel, doing that walk around of their vehicle, making sure it's safe and ready to go, is also an opportunity for them to make sure that they're safe and ready to go. So see a lot of value. It's a really easy thing, standard thing for organizations to implement. Get people to start looking at the vehicles they're driving, in that same process, thinking about, the drive ahead. If we have time, I'm happy to take any questions. Sorry, was that pop-up? Are all the tools mentioned? I didn't quite catch it there, Anna.
I just had a question from someone on email. Are all the tools mentioned in your presentation on the roadsafetyatwork.ca website?
Absolutely. Yeah, and I will, this recording and the PDF with active links will be available. So yeah, by all means, you can go to the website, and if you don't know exactly what you're looking for, use the search engine to find it, or like I say, all of these links will be available.
All right, are there any other questions for Rick? All right, with no further questions for Rick. Rick, I just want to thank you for taking the time to present to us today. You've given a lot of information, a lot of things for us to think about as a sector, and what we can do to support employers and workers in this very important area. I had a chance to review your website a couple of months ago. It's excellent. There's some really great stuff there, and I would encourage the participants to explore that website. Think about what's best for your organization. Think about what you think that are the most important things that you feel that can help benefit your organization and your staff in that process. I love the fact that you talked a little bit about, Rick, about the conversation, the onboarding component too, and just having those just formal and informal discussions for our organizations. I think it's really, really important. It's an area that I know that we're going to be doing a lot of work in the future with you and your organization.
Oh,
and so
good.
With that, I just want to thank you so much for your presentation this morning. It was absolutely fantastic. And as I mentioned earlier on, we will definitely make sure that this information is available to all the participants. And I know it's a small group. Very thankful that you're able to join us. And I think we're just heading into summer as well, and so we understand that there's some challenges and folks having obligations and whatnot during the summer. So moving forward, I just
one thing, if I may.
Yeah, sure.
Sorry, if I may just take up 12 more seconds. Not only, I think there's a lot of good information on the website, as you indicate. One of the other things we do, like, we're here to help. The folks at Road Safety at Work really want to help you. So if you have questions, you're feeling a little bit lost, you're not sure where to get this, that, or the other thing, where to get started, give us a shout. Send me an email, and I will do my best to answer your questions and help you get started, help you find the solutions that you're looking for. So I'll stop there. Thanks, Zach.
No, thank you.
Thank you very much for the opportunity.
No, absolutely. A great organization. I wish I had, had you guys on my radar earlier on than I do now, but you're here, and that's the most important thing. So thank you again, Rick. And Jeff as well. Really appreciated your excellent presentation as well. I think this morning was a real productive and very informative interaction and presenting information to our participants. And so next steps are basically, I wanted to just flag to everybody that are, a part of this the session that we are going to be having a few more webinars in September and October. The areas we're talking about, and I'm working very closely with our advisory panel that are subject matter experts. A lot of the stuff that we're developing is through this incredible group that's working very closely with me, and that I bring to the board's attention. And assessing and sort of understanding, what are the things that we really need to start working on. And so some of these other topics on the webinars will be pertaining to psychological health and safety in the workplace, violence prevention. As you know, we're a part of the higher risk strategies identified with WorkSafe BC. We're also looking at a very interesting and very challenging area around anti-racism and cultural safety in the workplace as well. And we'll also be working with WorkSafe BC to provide you preliminary information on the rates for 2024 as well. Also in September and October, our hope is to also plan an industry outreach with the sector And so I will definitely be bringing to your attention, you know, the locations in the province. It'll be an in-person, face-to-face type of interaction and providing valuable information and resources as well. With that, I just wanted to give a big thanks to Anna for her support in the back and in the background, and also David Small, you know, working so first, you know, really hard in the background in providing this really important webinar to you folks. And so at this point in time, oh, how many minutes do we have? 7 minutes extra for you folks before lunch. Cannot thank you enough for your time this morning. And I encourage you to share that information with your organization, with your JOSH committees, and also to your sister organizations as well. With that, we appreciate you taking the time out this morning, and have an absolutely wonderful and safe summer. Thank you.